see a 78 here. There's the medial pterygoid that attaches onto 78. Should be red.
77. Is that 78 or is it 18? It's 18. 54, 107, 106, 106.
It's attached somewhere. Here it is. No, it's 8. Okay, it's 78.
Okay, so it's not.
It's the same as this. This looks like
That's separate. Yeah. It looks like it's 18 because that's 20.
Well,
Oh, it's warm in here.
too warm, huh?
No, just don't need this extra jacket. That's never too warm for me.
All right, good. Never too warm for her.
And Lori's supposed to come at a specific time.
Make sure the door's open.
Yeah.
Baby, bring your phones to the nearby office.
So how's your
fever
thumb
room too.
doing?
Good. Well, I got it covered.
Yeah,
It
doing
looks better today. Yeah. As soon
Feels better?
as we took the stitches out,
Oh, you took the stitches out. Okay.
then it started getting better immediately. And
Okay.
the stitches were stopping it from getting better because they were
Oh,
they were just causing trouble. They're
Yeah.
getting infected. You know, like they're just holes into your body, and
oh yeah.
and then they things get in there.
Yeah. Okay.
Yeah. So when you're trying to work and that wasn't healing, and
Yeah.
then they're getting pulled, and
Okay.
so as soon as they went out, it started healing.
Okay.
But I'm sure they were good at first.
Okay. Good.
Looking good, looking good.
Thank you.
Oh, it's just about time.
Oh yeah.
Hey guys.
It is 6:30-ish. 2 minutes. Are we recording on this?
It's something. Oh yeah, go ahead. Could you give us? Do you have hot water bottles?
Yeah,
She
we
got
got it right there. Right there.
Oh, she's Johnny on the spot.
They're full. In fact, I need one right now. My neck is sore.
Okay, good, good. It's heating up.
Yeah, my neck is sore, so I need it now.
We're glad we have it there for you.
Start heating up first. Oh, this is what I was telling you about. It protects you from cell phones and
Yes,
computers and all
yes.
that kind of stuff. I don't know what's in there.
It's just a little bit like mine.
Yeah, it looks the same, but it's got something in there.
Special. It's
And I don't know what it is.
True.
All right, are we ready to start?
We're ready.
Hi, Sharon.
Hi. Hello. And we
Hi,
have-
Camille and Stephanie.
Stephanie.
All right.
We're all here today, so we're going to be helping everyone with ear pain, ear infections, ringing in the ears, noises in the ears, and so it's everything, and ringing in the ears. So those are all things that we're going to be working on today. It's things that we can do for ourselves and for our family and for our patients.
Great. Excellent.
Okay. So today, usually what we do is we start out with looking at the muscles that we're going to be treating and the referred pain pattern. Looking at the Rosetta Stone of myofascial, and looking at that and seeing what muscles cause the pain in the ear. And today, let's take a look at protocol number 6. So let's look at 6, and you'll see the most likely one is what? Lateral pterygoid. And the second most likely one is masseter, the deep. So those are the first ones we're going to look at. Then we're going to do a little range of motion for that. Then the sternocleidomastoid is the third most likely. Then the medial pterygoid. Then amazingly, the longest coli go into the ear and the longest capitis. And we're going to be looking at the posterior suboccipitals and the infra and suprahyoids. So we're going to do tests today, 1 through 4, 7, 8, and 9. So let's look at the tests we're going to do. So we're going to do the cervical rotation test. We're going to do the lateral flexion test, number 2. We're going to do the cervical flexion test and the cervical extension. Then we're going to drop down, we're going to do the scalene test, the scalene finger flexion test, number 7. We're going to do the mouth opening and closing, and 9, we're going to do the 2-knuckle test. So those are our tests we're going to be doing today, and that's going to be pretty easy. Get through those really fast.
Okay, great.
And we're thinking about underlying perpetuating factors and stuff, and as well that could cause, all kinds of ear pain and dysfunction could be caused by. What do you think might be one thing? Gum chewing.
Gum chewing.
Gum chewing might be one, or clenching our teeth. It might be it, clenching our teeth, gum chewing. Also asymmetry, so if one leg's longer than the other, or if one muscle's holding our hips down in such a way as one shoulder gets higher than the other, then you could have a lot of tension and pain and dysfunction on one side. So that can be also from asymmetry in the seating as well. And a big one is the head forward position. So anytime, so a lot of us are getting this from looking at small screens like that, so what we want to do is train the head to be balanced, and so we don't cause so much pain and dysfunction with the neck muscles, the sternocleidomastoid and the masseter and all the different muscles that cause pain in the ear. So we're talking about a couple different things. We're talking about draining the ear, which is one thing, and another thing is getting rid of the referred pain to the ear. So those are two main areas we're working on today, is those two areas. So we'll get both of those in.
Okay, awesome. And all parents can learn this too, right?
Oh, if parents would learn this, I was hoping that all parents could learn this. Every parent everywhere, because it would be so, what if they didn't have to go to the emergency room numerous times in a child's life, and what if they didn't have to put tubes in their ears, and what if the ears, they could train the children to drain their own ears, and they could help their children. Sometimes children go to Mom, my back of the throat's sore again. Could you treat that muscle right underneath my chin now again? So they begin to learn, and then you tell the parent when they need the help. And the kids are training the other kids to do it as well. So the parents are training each other after I train them, and then also the children are training each other. In some schools, a lot of the children already know how to treat their own ear pain and ear dysfunction.
Cool.
So I hope everybody can learn.
All right, awesome.
Yeah.
Thank
So
you.
today we're going to have Stephanie be our model again. Great. And Stephanie was saying that she was having some trouble with her jaw. So you could tell us a little bit about it. Oh,
It's clicking.
It's clicking.
It's clicking, and it also moves a little bit. So.
Okay, so you can feel it's not doing the right thing. Okay, so, and is there any pain in it too?
There's a little bit of tenseness in this side
The
area.
left? On the left side, a little bit of tenseness. Okay, so let's take a look and see what we find. We'll do our little tests, okay? Okay, so let's do our little tests and see what we find, and we'll make a few notes. So, Justin, maybe if you could just review a little bit, maybe if you could just show the referred pain patterns let's do the pterygoids and the masseter.
Okay.
So here's our pterygoid, and see how it goes into the ear right there. So this is our masseter right here. See how that piece of the masseter goes right into the ear.
Mm-hmm.
Then here is our medial pterygoid, and it gives you kind of that feeling like you have a really, really sore throat, and like a pain in the back of your throat. And so that's a nice, very important referred pain pattern. And so this let's see if we see the lateral pterygoid on here. No, you don't see any lateral pterygoid.
Yeah, sorry, the lateral.
Oh, there it is. Okay, here's their lateral pterygoid, and this causes pain really bad into the ear. Both the medial and lateral pterygoid will give us excruciating pain in the ear. So that's important. And so we'll definitely take a look at those. So these are a few of our real important ones. But one really, really important one, we've been treating it for the last few of the sessions, is the sternocleidomastoid. And you can see that it also refers right into the ear. And if you recall one of our newsletters, we have one newsletter that said, is this dizzy muscle causing your child to have ear infections, right? So you can see all of our newsletters. We have 49 of them, right, Justin?
Yeah, I think so.
On our website, you could and archive there under in the you can go on the resources line.
Yeah.
Click in it.
Myopane.com.
Myopane.com, and you can find that. Yeah. So the sternocleidomastoid is really important. It also is the dizzy. It also causes you to be dizzy and nauseous, and frequently you can get rid of the pain that it causes in the ear and around the eye, but it's even the dizziness and the nauseousness is so significant that people just can't even work or do anything. So it's a very important muscle. And then let's see, we're going to take a look at the supra and infrahyoids. We'll look at those again in a couple. Let's take a look at these muscles first, and then we'll take a look at the referred pain for the infra and suprahyoids. Okay, so let's take a look at our range of motion tests. Okay, so we're going to do some rotation. So let's have you go ahead and let's look at your heights of your shoulders. Very good. Oh goodness. Let's look at the heights of your hips, just like there, right there. Good. Excellent. Super. Okay, so you're doing really good with that. Okay, let's go ahead and let's have you do rotation. Let's come all the way this way. And so we'd like to get the chin a little bit closer to your acromion here. So let's go ahead and turn to the other side. And again, oh, that's very good. Very close to the acromion on this side. So it's a little tighter on the turning to the right side. Okay, and then let's go ahead and measure. We're going to measure with our fingers. We're going to measure, see how many fingers. Let's get your ear to your shoulder. Oh, very good. Oh, down to 2 fingers. Okay, that was good. So lateral flexion on the right, minus 2 fingers. Good. Let's see. Let's try that on the left. You must have been practicing. Okay, good. Okay, 2.5 fingers on this side. Oh, good. You did good. So everybody, why don't you go ahead and test each other in the same range of motion tests and see how good you do, and try the fingers, see how many fingers that you get. Okay, so cervical flexion. Again, now here we're going to see how many fingers. So let's see if she's got 3 fingers. No, 2. Oh, 1. Oh, none. She's got no. She's passing that perfectly. Okay, so she's passing that one. So cervical flexion, pass on that one. And extension. So extension, we want to see the nostrils going up to the ceiling. Wow. Okay, great. That's better than you did last time. That's what you call pass. Oh. Okay, so now not that the scalenes cause pain in the ear, but they would contribute to the fluid draining out of the ear. We're going to take a look at the scalenes as well. So we're going to do the scalene finger flexion test, and here you can see that. Let's do it this way so we'll see it really good. So we're going to put our hands right over here on this cabinet. Put your knuckles there. So we're going to go ahead and keep your knuckles on the wall. Oh, pass. Okay, let's try the other side. I remember you said that you weren't passing.
A few days ago.
Put your legs, your hand. Okay. Okay, she's passing. She's passing. So let's show them what a fail would look like.
I'm sorry. My fingers.
Let's do the other hand. Let's do the other hand. They show us what a fail would look like. So
a fail would be
like that. Yeah. So we get the whole hand back there. So the fail would be like you'd have space right here, and then so then you'd know. Oh, most likely you have compression of the brachial plexus here by the scalenes. The scalenes pulling up the first and second rib, and causing compression of all the nerve bundle coming down to the whole neck, shoulder, head, right there. Okay, so you did pretty good on that. Okay, good. Okay, next I think we're gonna see something with this test here. So we'll do this one standing. Okay, so we're gonna just take a look at you, like open and close. So you're going a little bit to the left and a little bit to the right. Yeah. Okay, so open and close. Yeah, so you're going this way and that way, yeah. So let's feel what it feels like. Oh yeah. So it's going over to this side over here. So it's going over to the left. Okay. So it's deviating to the left. Pass on the scalenes. Opens unevenly. I didn't hear any grinding or popping sounds.
Maybe the popping went away.
Well, maybe we'll look at it more carefully. And you're opening, so just put in one knuckle, and that's easy. Put in two. And does that feel pretty good? How does it feel when you do
No
that?
pain.
No pain. Okay, so you're passing that one. Great. Pass on that. Okay, so you did good with that. So we just have a few things to get rid of. Just a little, and then we want to get a little bit, maybe, we did very good, but maybe a little bit better with the rotation, and a little bit better with the lateral flexion, and making the jaw open and close evenly.
Okay.
So it doesn't seem so hard.
Sounds good.
Yeah, that sounds like we can do it. Okay, so let's take a look also at some of the referred pains of some of the other muscles we didn't look at already. So let's look at also the longus coli. So here it is. So here's the longus coli right here, and the longus capitis right there. I'll be treating those today, and let's see if they have their preferred pain patterns. Okay, they cause pain in the ear and in the eye, and it's also, oh, they don't have a picture of the referred pain. Okay, so it's in my mind. It's in my mind. So it goes in your ear, and it goes in your eye and your ear, and it causes like really unexplainable pain in the back of the neck. So pain that you can't ever get rid of, because you have to come in the front and take a look at the longus coli and see if that's causing your back of the neck pain. Okay, let's take a look at the super and infrahyoids, and again, they cause pain in the ear as well. So here's the suprahyoids and the infrahyoids, and they also cause pain in the ear as well. And again, she doesn't have the pictures of the preferred pain pictures of that one, but it could be that one. These muscles here, they open the mouth, help us swallow, and they also cause ear pain, eye pain, and generalized pain throughout the region. Okay, so let's see. In the posterior suboccipitals, we have a nice picture of them up here. They cause pain over the ear, just like that, kind of over the ear like that. And of course, they are the muscles that tip the head back and also rotate the head, just tipping it and rotating it, just like that. So those would be our muscles that we're working on today. Let's see, did we get them all? Yes, we did. Great, we did. Super. Oh, did we look at the masseter referred pain pattern? Yeah, we did.
Yeah,
we did. We looked at everything. Great. Okay, so we saw the referred pain pattern. Now, one more thing we want to look at is, do we have any nerve root activation? So we're going to take a look at you while you're standing and in other positions, and we want to look at. So here you can see the skin comes up really easy, but we're also looking for where it doesn't come up easy. Oh, it doesn't come up easy at about C6. So this would be in C7. So we have a little bit of spinal root activation. So here we'll take a look at that before we can take a look at it before we start treating her. So why do we treat these muscles that in this area? Is because these little rotatories and multifidi muscles. Oh, thank you. If they're tight, they'll cause slight nerve compression, which causes all the muscles in that nerve's distribution to be activating trigger points and higher tone. So we're going to look at that a little bit too. So, but you're pretty good. Oh man, from your description, I thought you've been. But anyway, she's been treating herself. That's why she was telling me how she had problems, but she already corrected a lot. Good. Okay, so we're going to learn to treat someone's ear infections, and so that would be important. It's good for them to learn how to treat themselves, and it's also good to learn parents and therapists how we can treat somebody. So let's go ahead and let's treat the masseter and the lateral pterygoid first. So this is the most likely one to cause the ear pain dysfunction. Okay, so let's look at that one first, and I think let's have you lay down on the table, and we'll put a little heat underneath you. Great, super.
Do you need another one?
Yes, it'd be nice to put a little one on her tummy. Okay, so
So heat behind the neck and shoulders, and then
yes,
one on the abdomen.
yes, and also we're gonna sandwich her in heat. We're
Okay.
gonna make a heat sandwich.
Heat sandwich.
Yeah. So we're gonna just put a little heat here in the front and start to warm that part up in the front. Great. Does that feel like it's balanced pretty good?
Yeah.
So these are these Foam and Tech hot water bottles, which are really good. And I also have a couple of other heating sources as well. This is a little heating pack there. Okay, so let's take a look. We're going to use some nice renewed facial cream here. Oh, we already tried it on you, didn't we?
Yeah, we did.
We did.
I tested it.
We tested it. Isn't that wonderful? Okay, good. So we're going to take a look at our masseter and first. So here we go. And I did bring a little skull with me, so we could look at the where the masseter attaches and stuff on the skull for a minute. And well, I especially brought it for thinking about where the pterygoids are, because they're so far in there, you know. So here we're just feeling the masseter. It's starting to relax a little bit. That's good. We're giving it a nice massage. It likes it. The heat and the massage is already starting to relax a little bit. Now the whole masseter. Now this, remember we treated the whole masseter before, and if you down here, the lower masseter right here, it causes pain up towards the eye and down towards the chin. That's down here low. And a little bit higher here, it causes it to, you feel it in the molars, the upper and lower molars right here. So if you also have teeth pain, then you'll also then probably, and ear pain, and your teeth hurt too, then it could be that the masseter is bothering you. Now here again, I'm coming right near so that the part of the masseter that causes the ear pain is high up. So we're getting close to it now. You feel it?
Yes.
Yeah. So I find some taut bands right here, some significantly taut bands right there. So that's what we're looking for. So once we know the muscles that we want to treat, we'd like to look in the muscle for taut bands, and I can feel some right here. Right there. Good camera work there. That's what you call zooming in.
Zoomed in.
So I can feel it right there. We can feel that there's some significant taut bands. Do you feel that a little bit in the ear?
Yes.
So what kind of pain pattern do you feel in the ear there?
It's just a little achy.
A little achy? Okay.
Yeah.
So when you're actually on the taut band that's causing the referred pain, you'll feel it in the ear. So I'll give it a little bit of massage, and then we're going to get really close to the ear. So now let's go right where the masseter attaches here. We're going to go right there and we're going to press right on the attachment there, and she's going to just breathe and relax. So those of you that are at home, you could partner up with your friend or significant other, or you could therapists that are in different parts of the country, go ahead and partner up and go ahead and start treating each other. Ah, now I found it here. What do you think of that spot?
Yeah. Ow.
We found the painful spot there.
Oh.
We found the
What
painful
were we
spot
calling
there.
it other than painful? We had a better word.
Oh, well, we haven't. That's good enough.
Okay.
Okay, so painful. So there.
Look at her expressions.
Okay, so we did find a few taut bands here. Now, the lateral pterygoid will be here as well. So we got the upper masseter and the lateral pterygoid. So the pterygoid, you can access it here as well. So going right, for the lateral pterygoid, we want to treat just above the cheekbone and just below the cheekbone. Now, how much pressure am I doing? So I'm doing one side at a time. If you look on the other side, go ahead and show my finger on the other side. Either I'm going to treat both sides at the same time, or I'm going to treat one side with this left hand, and the other hand is holding the jaw in place so that you don't push it over. So, I'd recommend that for us today. So we're going to go all the way back towards the ear, and we're going to press really close there. I'm going to give it a little massage. And let's go just above the ear as well. So to get the lateral pterygoid, we want to go just below the cheekbone and just above the cheekbone, very close to the ear. So that's what we're looking for, right there. We're going to give it a nice massage. Great. Let's put a little bit of heat on that. And let's put a little bit of heat on that. And let's go ahead and let's look at the other side. Let's look at the other side. So here's the masseter muscle. It starts here at the mandible there, and it comes up and attaches right here to the cheekbone. So we're gonna, and it closes the mouth, yeah, and sometimes causes what's called trismus, or small mouth opening. So we're heating up that side. You can heat it before you treat it. You can heat it after you treat it. So we're finding the bottom of the jaw, and we're rolling up and pressing on it. And amazingly enough, this causes, if you have eyebrow pain, it gives you significant eyebrow pain. This is the thing. So by treating this, you eliminate the eyebrow pain.
And we talked about that last week.
We did talk about it last week. And we're going back to the corner of the jaw right there. And we're going to come up from there a little bit. Now, so we just worked there first. Now we're going to come here. Now this is again a real important area. This tends to, in addition to causing ear pain, the masseter can cause tooth pain and cause us to have a lot of tooth pain, and the molars in particular, upper and lower molars. You can activate these by clenching your teeth, chewing on ice. It could be a habit that could cause trouble, more than one kind of trouble. Okay, so here we're going to go a little back here again. And we're going to come forward. And the therapist, the person who's treating, it's nice for you to just breathe and relax. And the patient, it's nice for them to breathe and relax. And you want them to be doing abdominal breathing, which it is. And you don't want them to be breathing in such a way as they're tightening their neck. So that's important. So you could train them or encourage them to use their abdominals, go up and to breathe with, and not to use their neck to breathe with. Give a little massage. Now we're going to come a little higher. So let's go to the cheekbone again. Let's go to the anterior. So we're going to roll down and push up. Come here and push up. That's going to get our top part of our masseter that causes the ear pain, and it's going to eliminate the pain caused by the lateral pterygoid. And put just a little bit more cream out. So just a little bit of lotion. Not very much. How does the heat feel everywhere?
Feels good.
She likes the heat. Okay, can feel some taut bands right here. And right there. Great, and then we're thinking about the lateral pterygoid. It attaches onto the top of the jawbone there, and I'll show that to us in a minute. So it's right here, so you can get that lateral pterygoid right underneath the cheekbone. What do you think of that?
4.
Look at that expression.
And we can also give it a little massage, and it goes right above the cheekbone, right here. Okay, let's see it do something. Okay, let's see you open your mouth. I got my finger right on it. And close. And I got my finger right on it. Open. And close. And open. Good. Let's see you go side to side. Good. And again side to side.
Ow, it's tight there.
Right there, yeah. So that's, okay. All right, good. So another area we want to get at is we want to go underneath the behind the mandible here, the angle, and we're going to feel that little, so look, feel right here, so open your mouth and close and open. So right there, so right behind there, we want to go in and up. How does that feel?
Excruciating.
Oh. Oh. Okay, so this is one area that often fills with fluid. It's good to get in there and make sure that we massage it and push some of that fluid out. So I guess when the muscles below don't allow the fluid to drain. Right there. So right behind the mandible, right there.
It feels like it's about to burst. Or
And I'm not pressing very hard. Just keep in mind. But it's definitely painful there. So if there's any swelling, the swelling is so painful, you know. So so it's our job to get the swelling out, get the fluid out of this area. So we want to eliminate the taut bands causing the referred pain, and we want to make sure that we push out any fluid that's in the area. Okay. So you could watch me for a second while I walk over here, and we're gonna just pull out. We'll look at a couple things, but we're gonna look at our skull. We got a skull, and we have a few muscle pictures to look at. Let's see. Okay, so come right over here. Great. Nope, not enough places to put things here. Okay, so here is our teeth. And here is our masseter muscle that we were just treating. See how it attaches? This blue part is all the masseter. Attaches here, and then it comes up here. It attaches right here where the red part is there. So that's one we were treating. Then we were also treating the lateral pterygoid. Now it attaches here on where the jawbone comes into the head there at the TMJ there. So here, let's get the teeth together. And then you can see how it attaches. Then it comes over here. So here's your cheekbone. Then here's the lateral pterygoid attaching above the cheekbone here, and comes over here below. So the muscle comes from here and comes over to here, and it can cause just excruciating ear pain. So we're going to be for sure treating it. We'll treat it in a couple different ways, but then it can be really also can cause you to have a lot of noise when you open and close the jaw. Tremendous amount of noise when you open and close, and it could restrict your side-to-side movement and your mouth opening. So it's part of it. Can be all of that. So then we're going to take a look at the sternocleidomastoid in a minute. But before we do that, let's look at the medial pterygoid. Oh, since we got our skull here, I guess we can take a look at that. So here's the medial pterygoid. It's attaches here under the jaw here, and then it comes over and attaches here on the xiphoid. So here you go. So it comes right here and attaches on the skull right there. So it moves the jaw this way. So when it contracts, it goes this way. So it's a big cause. It helps the jaw to really move side to side really well. And it's a big cause of back of the throat pain, sore throat, and difficulty swallowing. So when you have a problem with your throat, and the first thing you notice maybe is, oh, really sore throat and difficulty swallowing and painful, that could be this muscle that we're going to look at next. And so it's underneath here, underneath the jaw, and we're going to go like this and press on it underneath. So, you ready?
Mm-hmm.
Okay, we're going to do the left side, yeah. So, I guess we're going one side then the other.
That's right.
Okay. So here, we're going to feel it do its job. So let's feel it go side to side. Yeah. Okay, so feel it. So when both of them work together, both of the medial pterygoids work together. It opens the mouth, so it helps to go ahead and open. And let's go side to side. So feel that. Oh, it doesn't like to do the side to side. Does it? Okay. Okay. So here. Oh, it's right there. Okay, so feel it right there. Okay, so just relax. I'm just going to treat it. So we're going to come underneath and press laterally. You're going to come underneath and press laterally. Oh, you notice this, huh?
Mm-hmm.
Noticing. That's what you asked about, Camille. Noticing.
Noticing.
That's
We were
what
trying to think of what word we used instead of pain a couple weeks ago. We can't remember what that
and
was.
she remembered. I remembered finally. Okay, so we're going to look on the other side over here. And we're going to look over here. So,
Sharon, your patient has arrived who was,
oh, really?
yeah, Lori.
Lori arrived?
Yeah.
Great. Super.
So they're in no hurry or anything, but I just...
Oh, great.
This was a patient that had a child with ear infections.
That's right. So, Lori, you want to come back here? Hi, come on in. So, we're going to introduce you to our group. So this is Lori.
Studio audience. Here's Lori. Why don't you go over here by Sharon and then I'll film you both.
Okay. And so, so you've been. So the reason I brought in Lori and her son today. Come on in.
Brandon, how are you doing, my man?
Hi, Brandon.
Hi, Brandon.
So we're working here on Periscope, and I just wanted you to come in if you could tell all the parents how we started working with your daughter, and what you've been doing and how you've been training all the other people at school and things like that. So if you could tell us all about it.
Sure. So a couple of years ago, I brought Jordan in with me, and Brandon actually, to an appointment because I was ill, or I needed to be worked on, and I couldn't miss my appointment. And Jordan woke up with a fever that morning because she had an ear infection. So at the end of my appointment, Sharon so graciously said, well, I'll work on Jordan, and she was only about 7 or 8 at the time, and I was a
That's
little
right.
Wow.
surprised that could even be a possibility. And you spent, I think, about 10 minutes on her,
I did.
working all of the parts of her neck and her shoulders and her face, and showing me how to do that as well. And I went home that night and did it for, off and on, probably a total time of about an hour. And we used the water heating pads and whatnot as well on Jordan's, the back of her neck. And her fever broke, and the ear infection went away. And
Ear
I was
infection went away?
Shocked. I never took her to the doctor.
Wow.
And she woke up the next morning, was perfectly fine. So now, every time that Brandon, who currently has a bit of a cold, or Jordan has a cold, they want me to work on them, and knock on wood or plastic or something. But neither of them
I got marble
have
over
had
there.
an ear infection since then.
That's a long
So
time now.
yeah,
That
so
must-
Brandon's a little squirmier than Jordan, but I've definitely see as we can see it. But I work on the back of his neck and on the sides, and it's for me, a person who doesn't really enjoy taking medicine unless it's necessary. It's been amazing.
But also,
Wow.
wasn't it wonderful that the infection went away after you
Right.
got, when the ear drained, then the infection went away. Because
Right.
it's the lack of drainage of the ear that actually is causing the infection.
Right, that's what you'd explain, and you could feel it, or in her neck, you could feel how taut all of the muscles and the fascia was in here, and how the fluid had nowhere to drain because everything was just.
And remember, it had little lumpy too.
Right.
There was
Lumpy
like
all the way down.
There was like a
A lot of lymph
lot
or
of
something.
lymph
Yeah.
lumps.
Yeah, her lymph. Yeah,
Lymph
the-
lumps.
there were all down
That's the
here.
official term.
That's the technical.
Yeah,
that was
so we were
actually-
able to make all of that go away, and you could feel it, and that was neat for me because I'm not a professional like you are, but just as a mom, I could feel the improvement happening as, I would spend a few minutes, take a break, and then go back to it, and you could feel the difference.
Mhm.
And so I knew that I was making progress, and the only issue is whether or not, the child is squirmy. So I think Brandon would probably let Sharon work on him, but he's more challenging when I try to work on him. So we do shorter bits of time.
Wow.
Well,
But
sometimes a short's good.
yeah,
Short can
it
be
works. I mean,
good. Short can be good.
right?
Yeah.
Really tight in here then.
So neither kid ear infections for years since that time?
Yeah, so it's been
Is it
about
5 years?
about 3 years, I think.
3 years.
I think I brought her in.
She was 7 and be 4 years.
I think she was 8.
Yeah.
Yeah. So it was about 3 years ago. Yeah.
Maybe.
Yeah.
Yeah.
Wow.
So
Well,
it's
thank you very
exciting.
much. What a great story.
That's super great.
Wow,
Yeah, I'm glad
super
you
great
guys-
that we were able to do that.
I'm glad you guys came in today. Well, maybe if you would wait a minute, we might have a little time to do a little bit. Maybe it would help your cold a little.
You wanna do a little
Would you
work?
like to do a little bit? Okay.
Okay.
Why don't we just take a minute and so I was treating her longus coli like we did last week, and also treating her the sternal division of her sternocleidomastoid. So here I'm on it, and I'm treating it in full range here. So I'm shortening it and lengthening. I remember this could cause referral into the ear pretty bad, and could cause the ringing in the ear often. So does the little muscles right above and below the cheekbone. The little above and below the cheekbone muscles, they cause really bad ringing in the ear, and so does the masseter here, could cause some significant ringing in the ear. So if we could correct those, make sure to correct them. So here's the sternocleidomastoid. I'm really lengthening it and shortening it, and it attaches over here onto the mastoid right there. Let's take a look at the other side. So again, we could hold it down a little bit, maybe pull it down. Okay, so here it is. So we did this part earlier while we were talking to Lori. This is the division that attaches right there, and and then we treated that while we were stretching it this way. But the one that causes a lot of dysfunction in the ear is the one that attaches here and goes there, and that's this one right here. The collarbone to the base of the skull muscle here. New names.
Much better name.
Okay, so we took a look at all those ones, but one muscle group that we didn't look at was the the suboccipitals, the muscles right on the base of the skull. So we're going to look at those. This is one way of treating them. We treated them several different ways. We treated them standing, and we treated them in other positions, but now we're going to treat them here in this position. So I'm getting right onto the, so these muscles here just tip the head and back here. Just tip it, and they tip it and bring it this way, and they turn it, so they turn and tip the head. So we're going to treat those. So we're going to go, let's feel the C1, and let's go from C1 up to the base of the skull to get the rectus, minor, and major. So again, let's go down to C2, the second vertebrae, and we're going to go up again to the base of the skull. And let's feel the transverse process, and let's go from there up to the base of the skull. And on the other side, up to the base of the skull.
So you're getting the attachments and the insertions right now?
And then we're going to just the oblique inferior, and we're just going to give that a little turn. Get right on that oblique inferior and give it a nice little turn. Just a little turn, and then to the other side. So get onto that transverse, and then feel it right there. And let's give it a little stretch. Great, okay, so let's see you open your mouth, and open, and close. Let's see again, open, and close, and let me feel that, open, and close, and open. So I can see it's moving a little bit to this side over here, so I'm just going to go ahead and do a little bit of more treatment on this side. Let's see if we can get to open and close. It felt very good, there was no noise. You didn't hear any noises.
Yeah, it wasn't wiggling as much.
No wiggling. Now we did treat your temporalis a couple weeks ago, and that helped the zigzag. So that was good. So it's a little different today. So I'm just going to go take a look a little bit inside. Okay. So this is one thing we could do is, so we could just do everything from the outside like we just did, and that might do it, because that's pretty much what I trained Lori to do. But it also, we could go look a little bit more on the inside too. So we're going to do a little pincer compression on the masseter. So we're going to grab the masseter here. We're pincing it. So what we did up to now was mostly just plain compression. Now we're doing pincer compression. We're going to take a look all the way, so we're going to go along the lower molars all the way to the back.
This is the lateral pterygoid?
We're going to look at the lateral pterygoid. Then we're going to come up and go into like the little pocket.
Oh, there's one.
Way over there. And this is where you usually find the lateral pterygoid.
Yeah.
Now some people, it might be nice to use their little baby finger to come in here. So that might be another way of getting, so what you're doing is you're going to go up and then lateral. Now let's feel you open a little bit and close and open. They'll go side to side. Let's feel it do its side to side motion, and open and close and side to side. Good. Okay, let's look at you again, and let's see what we see. Let's see you open your mouth all the way.
Better do it right this time.
Oh, that's pretty open.
Wow, that's
what you call open.
Yeah.
That's nice.
You can strain plankton through that.
Okay, so
nice.
So I'm going to take a look at the masseter a little bit more. Right here. Okay, and I'm going to look at the medial pterygoid on this side. So let's just look at this. Go open and close. And open. Oh, okay. Okay, so that the medial pterygoid on the left was inhibited. Yeah. So it wasn't doing its job. So there's lots of reasons for. Yeah, there it is. Right there. Yeah, yeah, good. Breaking through it. We're breaking through it. She's breaking through. She's breaking through.
This is when the magic happens.
Whoa, she's breaking
here.
through it. Okay, good. All right, good.
Yeah.
Nice. Okay, so one more thing we're going to look at is the suprainfrahyoids. So we're just going to do something. We're going to just give it a nice squeeze like that. This is what we call pincer compression. So Lori, you're going to have something to look at home now, if you keep it.
You do all of this on me.
I've done it to her.
TMJ, you cured that.
Remember? Okay, so let's take a look at this. Let's come down here.
Well, the average person gets things like TMJ.
It can happen.
Yeah,
Mm,
yeah.
Sure it can. Yeah.
It's very, very common in modern life to get neck problems and all sorts of stuff.
Even at this age.
Even young people. Yeah.
Yeah, exactly.
Mhm.
And older folks like Stephanie too.
That's true. Okay, let's see. Open and close. And open and close. And open and close. And open. And open. And open. Good. Open. Great. Okay, so it looks pretty good. Okay, let's see how it feels. What do you think when you're opening and closing?
Feels lighter.
Feels lighter. Okay, good. Any pain or anything?
No.
Feels
Smoother.
Like wants to move smooth. Check a few of the muscles while you're doing it. Good. Okay, good. Okay, good. Let's have you go ahead and sit up. Let me move your pillows and things off of you. Okay.
Just go ahead and sit up while we've got you strapped down there.
Okay, so one more time. Relax for a second. So after being treated, it's good if we don't. I was going to have you turn to the side. So it'd be good if you turn to the side and don't lift with your neck. Okay, so go ahead and turn to the side.
And just sit up.
Couldn't catch you fast enough. Well, you don't have to do it that carefully, but as meant, don't lead with your neck. Yeah, because that actually could be an underlying perpetuating factor in itself. Is leading with your neck. Yeah. Okay. So again, let's see you open and close again. Open. Good. And close. And open. Good. And open. Great. Open. Yep. Open. I really feel these muscles working. Like open and see if you can really feel these really working down here. Really. Okay, pull it over this way. Open and pull it that way. Oh, she's doing it. Okay, open it, pull it. Yeah. He's making those work. Okay, make these work. You're doing it. You're doing it. You're doing it. Open. Oh man, this is what you call opening. Okay, great. This is super. Okay,
That's what you call opening.
Okay, let's have you stand up. So she doesn't have small mouth opening. That's good, right? Okay, so let's just look at you standing. Okay, let's have you open and close. And open. Great. And open. Great. Open. Okay, and let's have you turn. Okay, and let's have you turn. Very good. Very good. Ear to your shoulder. So we're down to one and a half fingers maybe. Okay, this side. 2 fingers here. Okay, good. That's pretty good. Oh, that's very good, don't you think? And chin to your chest again. Super. Nose up to the ceiling. Excellent. You don't have to do any better than that.
Okay.
That's good. Okay, you did very good. Let's see. We did you did the mouth opening beautifully, and everything's moving nicely. Right. Super. So you know everything to do now.
Yes.
Okay, great. Okay, so we're gonna take a look at you, Brandon. Yeah. Okay, so we're gonna see what's going on with them.
for you.
You're good. You're good. You're so friendly. Okay. Okay, so let's see the heights of his shoulders. Very good. Nice, nice. Heights of his hips. Very good. Excellent. Okay, so let's take. Let me look at you from the front. So tell me how you're feeling. You said a little bit of cold.
Well, yeah. So first, my voice was a little bit scratchy. Then
Really?
And I had a runny nose.
Oh.
Then my voice kept cracking. I got a cough.
Oh.
Now it's just cough.
A little cough. So, do you think it'd be nice for us to treat some of the muscles in your neck?
Sure.
Might be good. Okay. All right. Let's see if you pass the range of motion test. Okay. Okay. Let's ear to your shoulder. Okay, like 3.5 fingers. Okay. Ear to your other shoulder. Like about 3 fingers. Okay. Chin to your chest. Ah, perfect. Okay. Nose up to the ceiling. Nice. You can do that very well. Excellent, excellent. So we're going to check your scalenes to see if you have passed the scalene finger flexion test. You do. Excellent. And let's take a look at this one. Oh, it's even better on this one. Yeah. Great. So you're passing that. Let's see your mouth opening and closing and opening and closing and opening. Good. Very good. Excellent. So it just moved a little bit, but it was very, very good. Now, you're getting your head a little teensy bit forward, yeah. So it could be from music, whatever reasons. It could be. So see if it improves a little bit as we treat it a little bit. So it's a little bit forward. Okay, so we've got a little bit of warm water to lay out. Can I lower the table down for you, or I'll give you a little stool to come up?
I can get him.
You can jump.
Oh, you could, couldn't you? Oh, he jumped. He jumped. Good. So you can come up a little more towards me. Great. Okay, so we're going to take a look at some of the muscles that cause pain in the ear today. So this would be like you did with your sister and like your mother does with you. Okay, so good. So this is the masseter muscle. So this is could you give me the heating pad on his tummy? Yeah. So this is
a hot water bottle, or do you want?
Well, just this one. This here.
This one.
We'll make sure they're plugged in. Yeah. Oh, good. Nice and warm. Okay, so this is one muscle we would treat, and the way we would treat the children is frequently you just massage it lightly, and then you get onto a spot. You find a spot that feels tight, and then you just kind of press on it lightly and move it around. So you get right on a taut band, and you kind of move it around like that. So you get right on a taut band, and you move it around. Then you give it a nice massage. Now we want to particularly go underneath for ear infections and ear pain. You're going to get really close to the ear, and you want to get right underneath and really close to the ear, and press right in there. So press in and kind of move. Press in and move. Is it a little bit painful?
A little bit more up here.
Ah, up higher. Yeah, up higher is where it hurts a little bit more.
Yeah, like
yeah,
that.
right there. Yeah, exactly there. Yeah, precisely. That's the part of the muscle that causes the ear pain. Yeah, so it got a little bit dysfunctional. So this one causes pretty good ear pain and dysfunction. Let's feel it open your mouth, open and close, and let's see it go side to side. Your jaw, yeah. Okay, good. Now let's see your jaw go protrude of this chin out and then in. Yeah, in and then out. Yeah. Okay, that's good. Great. Okay, now we're going to go above the cheekbone right there. So get right next to the ear. So when you want to work on your children, make sure you get really close to the ear. Go right below the ear, and then you want to go right above the cheekbone right there. So right above and below the cheekbone, really close to the ear. So get right in there. Hi to all my friends in Hawaii, and hi to all my friends in Indiana and Nashville that are all getting together, and people throughout the country. Hi to you all. Okay, so this one here, this is good for you to learn. So this one's right underneath your cheekbone bone, your chin right here, underneath the corner of your jaw, right there. This one makes you have a sore throat, and makes you hurt at the back of the throat. And don't touch that too tight. So it makes you hurt at the back of the throat, and it makes it sore to swallow. What do you think? You notice that one? Is that a little bit painful there? A little painful there. So this is what you do. You'd find the corner of your jaw, and you'd roll under and up like that. So you'd find the corner of your jaw, and then you'd roll under. So what if you had a sore throat? You had a sore throat, and it hurt in the back of your throat, and it was difficult to swallow. You could check here, and then you could get right underneath the jawbone here, and then you could see if I treated it, would it make it better? And what if it goes away immediately? Then you go, oh, it's just this little muscle here is causing me to have a sore throat. So this one right here, underneath the jawbone, right there. Right where the corner is of the jaw, right there. So that's one that we're treating. So this is, that's an important one. Now this one here we're using the pincer compression for this one. So we're going to pinch it. What do you think of the feeling of that?
That's fine.
Good, good. So this one's real important. It causes all around the face, and also causes some pain up to the top of the head. The one that causes it in the ear is right behind this one. Okay, so the one that causes it in the ear, relax, I'll move your head if that's okay. Let me hold your head. Okay, is right here. Oh, he notices that one. Okay, so I'm just going to touch it really lightly and then move it a little bit. Okay, so I'm just touching it really lightly and then moving it. Okay, let's do it on the other side. So here's the one that goes all over the face and the top of the head and around the eye. So I'm giving it a light compression and turning it while I'm doing it. And then I'm going to look at the one that starts on the collarbone, comes here to the base of the skull, and I'm going to press it really lightly. What do you think on this side? You notice it?
Bit.
Yeah.
I
Okay,
mean,
so
I can notice it, but it doesn't hurt that much.
good. Okay, not that much. Good at this. He understands. That's pretty good. Good. So we'll give it a little massage after. Okay, great. So we did pretty good so far. We didn't find too many problems. Now we want to go behind the jawbone here and get in this little space here. You want to make sure that little space isn't filled with any fluid or anything. So let's see you open your mouth. Good. Okay, so what do you think of that spot?
It hurts.
It hurts. Okay, so we're just working it. Then keep in mind it could hurt really a lot on many people. So we could just work just lightly, really lightly like that. Just really lightly. And then over time, you want to keep treating it till it becomes less and less painful. So all these areas that hurt, you want to keep treating them till you push out all those painful chemicals, and it becomes less and less painful to be touched and less fluid. Okay, so we did really good so far. Okay, so now we're going to take a look and do a little bit of pincing underneath the neck here. So let's first just roll under the chin a little bit like that. Let's roll under the chin here. And let's work a little bit lightly there. Now we're going to look at a really good one. Now, do you remember longus coli? Did you ever try that on the kids? You did?
I don't remember if I
Okay.
did or not.
We're going to just work on it lightly. So I'm going to just touch it right there. Right there. So what you do, this causes pain in the ear. So you find the esophagus, and then you just come just to the side of it and press in right there, and then we're just going to massage. So we'll look at it again when you're seated. So what do you think of the painfulness of that one?
Wasn't as much.
Not so much. Okay. Well, I'm glad you came in today. Okay, so we're going to just look a little bit at the base of the skull. This causes pain over the ear right here. So we're just going to look right here for a minute. So just right at the base. So we're going to find the first vertebrae. We're going to press just above it. And then a little bit from the second vertebrae and up to the skull. Okay, great. I think we did it pretty good. So that wasn't too long, was it? Was all right? Okay. Okay, let's go. Let's turn to one side and then have you sit up. Great. Okay, then let's have you put your feet over the side and put them right here. Great. Okay, so let's take a look at your seated posture just for a minute. Yeah. Great. So, oh, that's really good. Okay, so let's look at my. Okay, so one reason you're so let's go back to the posture you were a second ago. Go back like this. Okay, your abdominals are pulling your chest forward. So if we go like this, see the abdominals don't want to let go. They keep pulling them forward. So if we train the abdominals to be a little bit more longer, then it'll help his neck. Isn't that going to be good? That'll be great. Okay, so let's just sit up a little bit. Great. Okay, so I'm just going to look at these. So these are good to treat. So you can find the skin right over your throat, right over your esophagus there. And you can go underneath there. And remember, let's see you open and close. And open and close. And let's do this again. Open. Oh, nice. And close. Let me feel everything. Open. Good. Nice. One more time. Looking good. How's it feel?
Good.
So good. So that didn't take too long. And that would be like a typical amount of time one might spend, right?
Yes, definitely.
Great. And we could work on his abdominals.
Right, his posture.
Yeah. Okay. So that'd be good for him.
All right, what
So-
are you saying?
Thank you.
Thank you. I'm so glad you came. Glad you came to visit us. Yeah. That's great.
Well,
So
thank
great.
you. I hope parents use some of these tactics because it was an amazing benefit for both of my kids and a great way to avoid the doctor. So,
Should we take a look at you too?
if you would like to, Sharon, I'm always available. Take a part of the body.
Okay. So.
And Sharon, we're going to need to take a break too.
Oh, we had to take a break now. Yeah, that's it. It's time for a break.
Yeah.
Okay.
Good time
So
for
let's take a little break, and have some water, some juice, and then come back in 10 minutes. Okay. Great. All right. Well, it's so wonderful to have you guys both
Oh,
here.
thank you. If you're going to take a break, I'm holding you then.
All right.
Oh, I thought you were going to work on you.
Oh, okay.
Thanks to meet you.
Okay. So, Camille. So one of the things that we did, all these fingers used to, this phalange used to go this way, this one, all of them used to be
crooked?
Now they're not, they're all straight.
Oh,
Isn't that great?
yeah.
We have pictures of everything. But
Oh,
here, with these,
I see that
these
one.
these here,
Very swollen.
It's very
Yeah.
swollen.
this is the ones that,
Middle finger.
yeah, this
How did
middle
they
one.
get that one?
She had a couple of issues.
Allergic
Many years
reaction
ago.
to vaccines 20 years ago. 20?
Yeah,
It was
to the-
93. It's
Was it
23 years ago.
was it the pertussis one?
No,
That
it
was
was
the
hepatitis B.
Oh, hepatitis.
But it was there was sulfide.
That was the sulfa. She was allergic.
They initially thought it was mercury, and then remember when I went to the nutritionist a few years ago, and we started talking about all the things that have happened to me physically, and we figured out that there was sulfa in the vaccine too. So.
But it used to be considerably worse.
You weren't here when I first came to see you. I couldn't walk.
Yeah. So she had a lot of issues that we were able to deal with.
Yeah.
Yeah.
TMJ.
Yeah.
So when you were doing all that stuff to her, that's what you did. And I've never had
You
TMJ
look
again.
perfect.
See? Yeah, they're just about perfect now.
Yeah.
Yeah, but they do. But isn't that wonderful?
Yeah. Amazing.
Yeah.
We're happy with that.
Right?
How old are you?
I'm 9.
9. I was gonna guess 12. Oh my goodness.
Like a sister.
9. All right.
Jordan was not happy that he was taking her spot.
Oh.
Yeah. Well.
Okay.
Your hair is, well, mine's too, but I just got mine cut, but your hair's all blown out. Is that for the lesson?
Yeah, that's it. You got it. You have to, make your hair look nice.
Yeah. Well, I had to wear a hood coming here on the bus, so I don't look like I look like who knows what.
Oh, perfect. You're perfect.
Yeah, right. And it looked better last week, I think.
So I've never met Justin. This is the first
Oh,
time I met
I'm
him.
sorry.
No, I introduced myself.
Oh,
I met
great,
him at the
super.
beginning. Yeah, he's
Yeah.
lovely.
Where do you
haven't
guys
seen
live?
you for a while.
I know. I
Where do you
know.
guys live?
We live nearby. Yeah, we live in Old Town.
Oh, in Old Town. Okay, good. That's cool.
And they go to a school not too far.
Oh, that's cool.
Yeah. Oh gosh, I swear I should just do like
Yeah, it's a little better.
a Is that?
Yeah, it's a
How
little
do you
better.
make your fingers not
Yeah.
crooked? How do you-
Okay, so what happened was this: is the different the fascia. There's this little thin skin that's around the bone, and it was pulling on the bone and was making the bone grow sideways. Okay,
Pulling really hard on it.
that's one, and then different muscles. One muscle goes this way, and another muscle. So different muscles
So
work.
do you like push this from?
Yeah. So what I did was I took all I found all the muscles that were pulling the bones in different ways, and I got them to just make the bone go neutral, smooth. So I got all the muscles to relax so that they would let the bone completely.
So you were working
Yeah.
the extensors first?
No, I did. Yeah, we did
Yeah.
everything. We
Okay.
we did it, but what we see that periosteum that's around.
This one used to be horrible.
Yeah, it was. It was like you wouldn't have believed it.
I'm
That we,
dying.
that's why we feel that we probably will fix this one eventually. But see, the thin skin that's around the bone, Camille, was attaching here, and it made her arthritis grew. So it made the bone grow lateral, and the muscles were making it go zigzag. Yeah. We fixed them all. So the interossei muscles were causing a lot of trouble. Yeah. Interossei.
I mean, when you first started working on me, I couldn't even. I mean, it was beyond. I mean, it still hurts, but it was so painful.
Oh yeah, now it's not painful like it was. Yeah.
No.
And even your husband sometimes helps.
Does Daddy ever help?
Oh no, he's busy doing other stuff.
He doesn't. He can't. He really can't handle like inflicting pain on me. You know what I mean?
Remember?
He doesn't do well with it at all.
You're right. He
like can't
You're right.
handle it.
You're right.
Did you ever bring that into your
But we're not. We're,
Daddy
we're,
had a lesson with Sharon.
we're breaking through the pain.
Daddy can't like. It freaks him out if he thinks he's hurting me, so he
Yeah.
can't.
It's like you can't do anything on your phone either.
I know. But I told him I need to. It's okay. Because it needs to hurt a little bit to get better for me.
Yeah.
I bet tomorrow I call somebody so much better.
But he's happy that we did it.
On Sunday night, like my nose was horrible Monday morning. Then my nose like completely stand up.
You still sound a little congested. I don't like wearing your best shirt this evening.
It's not his best shirt there.
No?
Oh,
Boys and girls
I didn't
are
notice
very
that
I
different.
part.
couldn't fit my hand all the way through the
It's really close. I thought I threw that shirt out,
A
but
little bit more movement to this, right?
He found it. He found it. And we
So
brought
you
it
have to
back.
put it at the bottom of
I
the
used to
bag.
not be able to bend it all. At least now I can like
Oh, yeah.
bend a little bit.
This joint here is.
Stephanie, see, she had all these fingers on this hand. The bone grew lateral, like this, and so these fingers used to have big bony parts that stuck out everywhere. And this phalange went this way, this way.
Oh, this one's got better
And now
movement.
we've got it all
This one
bending.
is the one that
Yeah,
needs
see?
the movement. This
It's not perfect, but we had to treat the interossei, all of the skin, and all of the flexors and extensors, and we got them all.
This
It's
one's more
very
swollen.
swollen.
This one's stiffer.
I'm not
This
sure
joint
why I'm
here-
so swollen today. I don't know
This
what's
joint here is,
wrong.
all of them were worse than this joint when we started. Feel that joint. Stephanie's one of my apprentices,
Ah.
and Camille is a therapist we've been working together for quite
At least 150
Yeah.
years.
yeah. So what I do is I challenged it, every one of the muscles, and then also ligaments and tendons and all the fascia around the bone.
Oh yeah, this one's pretty good.
Oh yeah, very good. This one's coming along.
Yeah.
Do you feel it a lot right there?
I know,
Okay, good.
I was
Little bit
fighting
more
with
movement.
Gina today because I said you've taken over the favorite position at Sharon's. She's like, but I go every week. I'm like, I know. But I went every week for like 5 years.
Yes, she comes more frequently. She's doing very well.
We still talk about is it Allie, the little girl?
Oh, yes.
God, that was such a
Yeah.
so
So-
amazing.
So
Yeah.
when I try to move this, do you feel it more underneath or more on top?
It's tighter on top more.
On top.
Yeah.
Yeah. So then I would for sure treat the extensor that goes to that muscle,
Yeah.
to that finger,
Yeah.
and then I come up here. So I really, then I notice what's making it bend better. And I put the flexor, look at what's making it bend the other way better. I put it, but I challenge it.
Yeah.
That's how I got it all. But these are our two last challenges here.
The pinky's a lot better.
The pinky was so bad.
The pinky was really bad because it was swollen everywhere. Now the top is straight and the bottom, just that bottom. Yeah, I'm so swollen today though. It's gotta be from the cold.
Yeah, it makes us all do that.
I mean, like they're really like puffy.
Whenever you feel it coming back,
I know.
we gotcha.
Been a little crazy.
Okay.
All right. Well, thank you so much. I hope Brandon was
Thank you.
helpful.
He was.
And thank you for working
Thanks for
on
coming.
it. It was nice
Thanks
to
for
meet
coming.
everybody.
Yes, you too.
All right.
Thank you.
All right. Good luck with the rest of your session.
Oh, thanks.
Bye.
And you're in for posterity. Everyone knows now.
Everybody will see you on TV, YouTube forever. You're so cute.
Okay, let's see.
I brought your song again today so we could play it at the end.
Mhm. Oh, thank you. Thanks.
Of course, I'll
Right
bring it
there.
every week. You just have to do different movements every week. So you were working with your thumb. I was ready to step in there, but you were doing okay.
Thank you.
I was waiting.
Oh, I'm doing really well.
Okay. I didn't know you'd be able to squeeze with it, but you did okay.
Yeah, I'm doing very well with it.
Okay, good.
Particularly since they took the stitches out.
Yeah, that's
I've
what you
already said
said.
that. Yeah.
Yeah.
So it just was so. I mean, of course, I wanted stitches, but I mean, they were very annoying.
Yeah.
In terms of trying to use your hand. Yeah.
Yeah.
And I pulled out several of them.
Oh.
So, accidentally. So.
All right. Is it time to start again? It's
Yes, just about. Yeah.
So what are we gonna do next?
We're going to talk about underlying perpetuating factors. And we'll do some range of motion.
Do you want me to get the video?
Oh, yeah, you could do that.
So what do I hit when you're ready to start?
Okay, so here's our protocol that we were using today. So we have the body cordoned off into 60 areas, and this is one of the areas, area 6. And here's all the muscles that we treat. This is often I send people home with this. and we often, could you hold this for me here? So often I highlight the area that I want them to treat. So I highlight the masseter area, and then I might have a tool. I might show them a tool that they would use to treat it. So maybe I'd use I put a little tool here, a little index knobber tool, and that would be for treating the masseter. And then for treating the SCM, maybe I use that tool, or maybe I use another tool. Go ahead and color it in for them. And then often I use this big S-shaped tool for that. And then, or you can show it off. Okay, she's going to show it off. Okay, go ahead and look at it. She's showing it off there. Thank you, Camille. Okay. And then here, frequently, this is the sternocleidomastoid. We usually use that with squeezing it or pincing it. And here we do that. And then for treating the medial pterygoid, we're going underneath the jaw. Here, we'll probably use our fingers again. And I have some little notes here. The area that we treated that was also the front of the neck was the longus coli and the longus capitis. And that, so I draw that in for them. And then put it right there, and I just use your fingers for that. So just put finger and finger. And the lateral pterygoid would be right above and below the cheekbone. So I'd be making some notes there, the lateral pterygoid. And again, we could use this little tool, or we could use our fingers and get right in there. So this is helpful to send your patients home with, and you could download this, right?
Yes,
Justin?
absolutely.
You could say something about the downloading part.
Yeah, you just go to myopain.com, and then you'll see lots of ways to go to the Bodyworkers Mastercourse page, and on there there'll be the links to the Google Drive folder, which has all of the protocols in it, all 60 protocols, and then also links to either the Periscope TV link and the YouTube channel. So everything you need is there, plus there's some posters to download, and we'll get more stuff as needed. Some of the evaluation forms might be nice to have there, so we'll get those eventually. Okay?
Great. Okay, so also for the area that we treated, the super and infrahyoids, then I usually put little X's all over for that. And I usually have people do the pincing for that, so let's go ahead and color that in. And then we're going to put in the supra and infrahyoids. Okay, so this is something I would send home with the patient. So I thought we could do some self-care so we can all learn how to treat our own ear pain or ear noise, or pain or get it on the right side so they're not upside down, right?
Yeah.
Or ear noise. So that's important. So this will help with ear pain, ear noise, clicking in the jaw. So what are some of the underlying perpetuating factors? Okay, so what do you think they might be? They'd be the head forward. Head forward is one. How about grinding? So which comes first? The dysfunction of the muscles causing the grinding, or is the grinding cause the dysfunction of the muscles? So it could be both, or either one. Okay.
The chicken or the egg.
it could be both. It could be either one. So, but it's good to we'll treat the muscle, and then if we calm them all down. So what I like people to do is do this, everything we just did, but just before you go to bed, if you're trying to stop from grinding or clenching your teeth, I have you release all these muscles before you go to bed, and I'd ask you to treat the trapezius too, sternocleidomastoid, the same muscles we treated the last few days that we've been together, and then do that before you go to bed, and then it's very likely that you'll not grind it and clench at night. But of course, it's nice to put a guard in so that might be useful for many people, to put a guard in so you don't grind your teeth so much. But many people still clench really hard. It doesn't help. So if the clenching, you've got the guard in there, it fixes your teeth pretty good, but if you clench really hard while you're sleeping on the guard, it's still going to give you a lot of tension in the muscles. So what's another really important underlying perpetuating factor? One that we were working on with you, that you were perfect at, but maybe we weren't perfect at a while back, which was breathing in such a way to tighten your neck. So the way that you check for this is you ask people to take a nice normal breath, and then you notice. So what if you took a breath and you lifted up your shoulders and like this? So go ahead. If you're taking a breath and lifting up and tightening your neck. Okay, you go. Oh, that's what we call paradoxical breathing. Okay, so what we want them to do is not to lift their shoulders and not to use their neck. And what you want them to do is put one hand on the neck and one on the tummy. And what you want is the tummy to go up and down and in and out. But you don't want the neck to be going and the shoulders to be up and down. So she can test herself. Oh, you're so good at this. Oh man, are you good at this? Okay, so she can put one hand on her shoulder, one hand on her tummy, and she's noticing, standing, that she's breathing in such a way that it's not tightening her neck. Isn't that wonderful? That's great. So she can do it also while she's walking. So go ahead and let's walk while you're doing it. So it's kind of like you're doing it. You could do it seated, you could do it lying down, and you could do it walking around. So you get so used to it that you would never tighten your neck. So this is how people do. They breathe in. You tell them to breathe, and they tighten their neck. Their shoulders go up and down, and they hold a lot of times they'll hold their tummy in, but they really hold their stomach in, and there's no place for your breath. Then you have to really lift your shoulders and neck in order to get your breath in. So what that does is it really tightens up your neck muscles and won't allow your ears to drain. So it's important to make sure that your children and your family members and your patients, oh, you're doing so perfectly. I can't believe how perfect you are. So we're so good at this. Okay, so this is really important. Okay, other underlying perpetuating factors would be if your one shoulder is higher than the other, or if one hip is higher than the other. And that can happen from one leg being longer or shorter, and it can happen from one hip being shorter. So you can have one side of the body, a whole side of the body that's shorter. So Travell, often my teacher, Dr. Travell, she often said the side of the body that's shorter sometimes will be also shorter. You could measure from the ear, from the corner of the eye to the mouth. And you'll see that's shorter. The side of their face is shorter. Their whole side is a little shorter. So if that's true, we'll want to support that person and make them even. So we're just trying to make them even all the time. Now the one thing that we didn't work on already yet is the so for these muscles that go to the ear, we want to look at the nerve roots starting from C1 all the way to C6. So this would be from vertebrae 1, 2, 3, 4, 5, 6, and 7. So you want this to be nice and loose and flexible. So I think I'll treat that for you standing, and then we'll do it other ways as well. Okay, good. So the ponytail's fine.
Okay.
So since this is unless Justin doesn't think so.
It's good.
Okay,
It's fine.
Good. Okay, so here we're going to look right here. So here we're looking at the little muscles. No, that's okay.
Is that good?
Yes. So here we're going to look at the little muscles that are that attach. Can we look at them on the picture first?
Yeah.
Yeah, let's.
Sure.
Yeah, I think make you get up.
No. Good.
Okay. So here they are. Here the little. See how they're right along the spine, and they rotate the spine, and they also extend the spine. So we're gonna treat them a little bit while they're. Oh, she's helping us here. Okay, so we're gonna treat them a little bit flexed forward and rotated. So we're gonna go ahead and press there, and breathe and relax. Good. And we're looking for some taut bands, so we're looking for a taut band. So I can feel one right here. And when we tested her earlier, we found that she was tight, like down here at C5, 4, 5, 6. So we're turning, and we're really turning. Okay, so let's go ahead and let's see if we improved it. Yeah, it's a little better. Oh, and we're doing a little self-care.
Yes.
Okay, so here we go. So here's our little rotatories here, and I'm feeling them right here. And so I'm feeling their ability to allow the range of motion here, the twist. So I can feel I've got some resistance in this one right here. So I'm going to hold it for. So when you find a taut band that's painful and hard, you can hold it for 2 breaths or 3 breaths. You can come back to it a couple times. Oh yeah, that one was holding my fingerprint. Okay, I'm going to use my other hand. Okay, we're really rotating and tipping down. And this is where we found the dysfunction when we did the skin rolling. And Dr. Fisher used to always say, you have to do the skin rolling. You must do the skin rolling. He said, you have to do it. Okay, so here, you can see the skin's coming up nicely. And here, so right here, we still a little bit below into C7, 8 in here, T1. It's we still have a little bit of dysfunction. So, but here's pretty good. Okay, so let's do a little bit more with it. We'll do a teensy bit more with it. Let's do it with you laying down. Okay. So it's so important to make sure that the nerve roots are corrected, because it's a really important underlying perpetuating factor. Put a little bit of warmth under your tummy. So it's pretty cold in Chicago today.
Yeah, we had a nice weekend, but it snapped back into its normal winter routine.
It sure did. We got our normal winter routine, all right. Okay, so if you go ahead and lay on your tummy, and come up high and put your head here, and I'm going to have you not use the face cradle this time. Yeah. Let's see if you can get comfortable and put the top of your head there. Yeah. Yeah. So we're going to just take a look. Is that relatively comfortable?
Yes.
With the face cradle?
Sort of.
Okay. We're going to give you the face cradle. Okay. Let's see where we put it.
I think it's in the other room.
Oh, we put it in the other room. I see. Okay. We'll put you there for a second. Oh, you're good. She's good. Yeah, she's good. We put it in the other room. Okay. Okay, so we're going to come through. We're going to treat this little area here. Again, we're going to take a look. We're going to feel the spine with our elbow. We're going to come just lateral and get in that lamina groove. You found it. Okay.
I found it.
Going to get a pillowcase. You don't know where they are.
No.
Let's take a look on the other side. You guys go ahead and give that. Yeah, great. Thank you. Okay, so okay, we're going to come here. So we feel the spine with our elbow here. We're going to come just lateral and press in. Good. Okay, let's just go ahead and extend for a moment. And there you go. So tip your chin down. Yes, good. No, not quite. Okay, good. Is that okay?
Yeah.
Okay. So we're going to come right here.
And again, I see you going toward the spinous process, then
That's it.
toward the lamina again.
That's it. That's what I'm doing.
Spinous and transverse, spinous and lamina.
Then we want to check. Are we doing better? So I'm shortening them a little. So I might keep working with it over time and to make sure we can get this improved. Okay, let's have you come up onto your hands and knees for a minute. And come up like an angry cat. And then come like an old horse. Give a nice spine, a nice stretch, contraction. And down. Okay, so one more thing with you laying on your back. So that's pretty tight in that one spot. So tell about that spot.
It's just really, really stiff.
Uh-huh.
I normally sleep on my back and with a thin pillow, but it's always been sore.
Okay. Once you come this way, but now you're gonna have your head off the table. So come all the way towards me. And just stay right here for a second. And we're just gonna put a little heat on you there. Okay, come on back. Keep coming. Come towards me a little more. Okay. Good. Okay, so I'm just gonna take a look at that. So I'm just gonna put my finger right in the same spot you saw. And then I'm just taking it through some range of motion while I'm pressing on it.
So Sharon, this is an interesting kind of an example of what is so different about what you do and what a lot of people do is that how would you say you're envisioning that piece of fascial tissue right now?
Well, I can feel that it's pressed together. I can feel it from the one bone to the other, and I can feel that it's restricting the range of motion.
Mm-hmm.
And so I'm trying to encourage the range of motion. You know, I can feel it right there. Yeah. So I can feel the periosteum is kind of tight.
Mm-hmm. So and you know that what it should feel like.
That's it. That's it.
And
it should feel
how it should feel, and then you just keep going until you get it.
That's it. That's it. That's it. That's it. You've got my technique down.
Yeah.
Thank you, Justin.
Well, it's just such an important, different philosophical approach.
Uh-huh.
Most people would say, perform the technique, or they
Perform
might,
the technique.
yeah,
Yes.
or they might say, these are good areas to work.
Okay.
But very few people say, keep at it until you've got what you want.
That's it.
Until you've got that full function.
Yeah.
Try whatever it takes to get there.
Yeah.
And
and we don't have to give up because we've got a whole life.
yeah.
And we even if it's difficult, it could take a while, but after a while, it's done.
Yeah.
It's fixed. So no matter how long it takes.
And then there's just this amazing epiphany for the patient and a reward for you and your work that happens simultaneously, which keeps you motivated and excited. There's nothing quite so...
Feel that right there?
Yes.
Okay, so I can feel the fascia is adhering the two vertebrae together right here, and she feels it too. Yeah.
But you move through as much as you can anyway.
That's it.
Yeah, it can be very uninspiring to work on something and then have it not quite get the full results that you'd like. And if you have that
Right.
once a day, that can be a little uninspiring. If you have that 2 or 3 times a day, I mean, eventually you can get an emotional burnout from just encountering barriers that you're not breaking through. Just getting halfway through isn't the same thing as getting all the way through. And when that patient or client on the table knows that you're not going to give up until you get all the way through that barrier, there's an incredible trust that evolves too. And again, that it just applies to so many areas of life where you're struggling and you've given 50% of what's needed and you haven't gotten the result you want yet, and it can lead to a lot of different things. So just in every area of life, keep making it work, get it to its total full function.
That's it.
And look beyond the pain, look beyond the challenge, know what it should look like and feel like, and then just keep at it until you get it.
So it's feeling quite a bit better. So would you say it's less painful?
It's less stiff.
Oh, it's less stiff. Okay, good. And on this side. So this could be what's called a pinched nerve in some cases,
Mm-hmm.
It could be called a stiff neck, a raw neck, or a right neck, or a pinched nerve, or heightened tone in the muscles, and that nerve's distribution in all the muscles.
There's always that old subluxation.
Oh, yes. We could use that expression.
We chiropractors like to use that a lot.
We do. When we're chiropractors, we use that expression.
But just look at how much movement you're getting in that vertebra, and you're eliminating the nociceptive shutdown,
Okay.
and
And if
you're
I
working
could
on the
go ahead and
fascia
go
at the
ahead
same
and sit
time.
up, and then go ahead and great. Okay, so let's go ahead. See how good we did? All right, let's go ahead and have you stand up again. Jumped off. Okay, oh, that's kind of nice now.
Aha,
Big
see?
improvement.
Okay, so that's good. So this is the area here where we're trying to improve, and we did it.
Yep.
That's good. Okay, so that was good. You can lift that up. Yeah. So that shows that the nerve is no longer slightly pressed, and now it's no longer causing heightened tone in its distribution. So, okay, so maybe we could treat some of those muscles we treated today on ourselves.
Okay, self-care
good?
time?
Self-care.
All right.
Okay. So
Do you want
we
this
have-
one? You like it?
Yeah.
Go ahead.
We like these. We like these tools. This is one of our tools we like to use. Another tool that we like to use is this tool right here. So that's a great little tool. Okay, Camille, you could treat yourself too.
Sure. You can't do it. Get it on you.
Okay. Okay, so let's go with the treating the first muscle that we treated today. One way that we like to treat that muscle, our masseter. So here's our masseter muscle right here. Comes here and then comes down to there. If it's too tight, it won't let our mouth open. So our mouth opening would just be open, not hardly open. So this is one way of treating it. So the most important spots are right below and right above your cheekbone. So let's go all the way back towards the ear and go right there next to the ear. We're going to go right there. What do you think of that spot? What do you think, Camille?
Okay.
You make it open and close while we're doing it. And let's go right above the cheekbone. Right there.
Is one end of the knobs for the big
Yes,
bend
okay, so-
smaller? Why don't
yes,
you use
so-
the smaller ones?
Oh, yes, she should. Yes.
Yeah, There you go.
Oh.
I was like, something looks so abnormal compared to Sharon. Oh, it's the size
Well,
of
it's
the
a
knob.
little knob here.
Yeah.
It's nicer.
So one size, is that the same with the back knobbers?
Yeah, they're two sides. Yeah,
Oh,
there's
Two
this
sides.
side.
So you've got the big knob
Mhm.
and you've got the littler knob.
But these are bigger
So let's use
than
this
the
little
other
tool
one.
for the other side.
Yeah.
Right. Interesting.
Okay, so we're going to do the other side with this tool. So here we're going to go. This is a nice tool. This is nice because it's so small you can take it with you everywhere.
Yep.
So it's a nice tool. They call it the
Index knob.
index knobber, but you might call it the wooden index knobber that they sell.
If it's pressure positive, it's got to be a knobber.
Yes, it does have to be a knobber. So again, let's find the cheekbone. Let's go all the way back towards the ear, and this is where we'll find our spot in the masseter that causes the ear pain and the lateral pterygoid. Right there, right below there. Let's go really close to the ear, and let's open and close. Let's go side to side, and let's protrude, retract, open, side, side. Great. Okay, so let's go right above the cheekbone and sort of down into it like that. And that's going to get that lateral pterygoid too. So let's go ahead and press on it. Let's open and close and open. Good. And let's go ahead and give it a little massage with our fingers.
Was that one over or under the cheekbone?
What was that?
That last one was over or under the cheekbone?
We did both.
Okay, both.
Yes, both.
Yeah.
So if you take a look, you know, I did bring something fun to look at, Justin. But the lateral pterygoid, I brought this, found this in my closet.
You had the skeleton in your closet? I thought trigger point therapy was supposed to fix that.
Yes,
Is
yes.
that in the old house or the new house?
The old house, okay. So here's our cheekbone right here.
Mm-hmm.
And this is the lateral pterygoid. And it comes from, attaches onto the mandible here, the little neck there. And then it goes over to here and attaches here.
Oh, it goes all the way up there.
So it goes above, so here's the eye socket, so it goes right above the cheekbone and kind of like right below the cheekbone right here.
I see.
And then here's our masseter, and it attaches right there. Okay, so that's our those two muscles. Now another real important muscle is the medial pterygoid, and that attaches here and attaches onto your skull right there.
Yeah.
So let's take a look at the medial pterygoid. So we're going to find the corner of your jaw, and let's go underneath it and then back out towards the, so I'll do it on this side. So let's find the corner of the jaw, and then we're going to press in and then out that way. And then let's feel it do its job. When one of them's working, you'll feel it move your jaw to the opposite side. So let's feel it do that. So, oh, there it is. It's moving it to the opposite side. See how it's moving it to the opposite side?
Mm-hmm.
So that's the medial pterygoid. Remember, that one causes really bad pain in the ear, and it can cause some very bad sore throat and inability to swallow without pain. So let's find the little corner of your jaw on the other side, and we're going to go underneath it and out like that. And let's underneath it and out. Let's get our little finger in there, and let's feel how this muscle makes the jaw go to the opposite side. Or what if it was dysfunctional? You might feel, oh, it's so painful, and you notice that it doesn't do that. You notice it didn't do it. And together, they will feel how they open. So feel them both together. You can see how they're opening. So when you first get a sore throat, you could look there and see, oh, it's just that muscle causing it. So now let's go behind the jawbone. So let's go behind the bone, underneath the ear. We want to make sure this area isn't filled with fluid. So we're going to go right here and go behind it and go right there. And come on back.
So this is what you would train your patients to do if they were fixing
Yes.
ear infections.
That's it. I would do that. Get it right back here. And it shouldn't be painful here at all. Like, you should be able to just press in here. And then one thing you should feel is when you open the mouth, you can feel the back of the mandible transitioning going forward. What if it's, a lot of times when you can't open your mouth, this part here isn't transitioning going forward. It's just all sore and full of pain. So we want to make sure that we push all the painful